Hey everyone, I'm Ray Smith, and this is The Long Road to Medicine. So, you probably clicked on this video because you didn't match. First, I want to let you know that you're not alone. I remember not matching 1 year ago, like it was yesterday. Match day comes, and there's no envelope waiting for you. You feel hurt, embarrassed, shocked, and there's grief that comes along with it, and every emotion in between. I want to say this clearly. I'm sorry that you didn't match, and I remember every little bit of emotion when I didn't match the first time. Not matching was one of the most difficult moments of my life. I had so many questions running through my mind. How am I going to support my family? I don't have a job. What do I do next? How could this happen to me when I had 20 urology interviews? And if you're asking those same questions right now, that's completely normal. Give yourself time to grieve. However, I also made this video because I want to give you the next steps and what you can do to secure your future. I went unmatched in the 2025 urology cycle, and a few months later, I was successfully able to match and matriculate into a PGY-2 urology position. It is possible, and in this video, I'm going to give you a clear game plan for what to do next. So you may be asking, what are my options? So there's really 5 different options after talking with other students that did not match. One is delaying graduation and pursuing or finalizing your research at your home institution. And we'll talk about all the benefits and cons of each option. 2 is a general surgery preliminary year or years. Same thing goes for 3 in terms of a urology focused preliminary year, where you can do from 1 month up to 6 months. 6 months would be more of the urology focused. However, you can have urology rotations during your general surgery preliminary year or years. Dedicated research year or years, and dual applying or pivoting. So, delaying graduation or pursuing or finalizing your research has a few benefits. One, you get to stay at the same institution. And so, all of your faculty members, if you have good urology faculty members that you can do research with, you can finalize your research if it wasn't done, and if that was why you didn't match. Especially when you have the great mentors, they're able to advocate for you, they're able to lead you and really allow you to pursue that research that you need to finish and complete in order to strengthen your application. Another benefit of this is being able to do additional sub-Is, not only at your home institution, it may be categorized as some other class. However, you're still able to do an additional sub-I, and you can go ahead and go do additional sub-Is at other institutions. The negative aspect of this is going through medical school and having another year of debt. Likely your scholarship will not cover that extra year that you're postponing unless it was already included in some type of scholarship grant or opportunity before you even applied for this 4th year. Usually those opportunities happen between 2nd and 3rd year, or between 3rd and 4th year before you apply during your first initial match cycle. The other negative aspect is it requires school approval. I remember when I didn't match and went through this whole process, my school did not allow me to delay my graduation in order to do those sub-Is, to do that thing, because there was no hindrance, no negative aspect of my application besides not matching. And they figured that I can go through and do a preliminary year, which for me was the best opportunity that I could have been given. During this delaying graduation phase, I would strongly encourage you to finish your research, finish the things that you have started, and really get going on the negativity or the aspects that hindered your application. General surgery preliminary year or years has quite a few benefits. One is you can go on there, take step 3, knock step 3 out of the park. So if you got a lower step 2 in the 230s, 240s, you can go ahead and take step 3 and knock that out of the park, because there's not a lot of residents that are really actively studying for step 3. All the residents just go in there, take step 3, and it's more so of a pass-fail, a thing that needs to be taken in order for them to moonlight or to go on the next step of their journey through residency. The other aspect is I would also strongly encourage you to take step 3 and get a higher step 3 score, simply because if you even get a high step 2 score, step 3, if it's lower, may look like a fluke on your application to some program directors or some faculty members. You're going to be making probably more than a lot of you have ever made in your life, and you're not going to be taking on that debt, and that's definitely a benefit. Another benefit is that you can demonstrate clinical maturity not only to yourself, but also to the faculty, the residents that are with you, and really proving that you know what you're doing and you know how to become a resident. During your interview process as a medical student, you're saying, oh yeah, I can do this, I can manage my time, I can do these clinical aspects, but while you're in residency, while you're doing a preliminary year, you're proving that aspect. And this also leads to greater letters of recommendation. You're going to gain operative exposure. There may be some attendings that allow you to do more or less, but if you're the only resident in that case, you're going to become the junior surgeon in that case, and you're going to gain a lot of operative exposure compared to when you're a medical student. And there is a lot of exposure to gain, whether you're doing general surgery rotations or whether you're doing urology rotations, if they allow you to do that during your preliminary year. During this time, I'd highly recommend that you guys finish your research projects that you started in medical school or even during your preliminary year to show that you're not only becoming a great, fantastic resident and you have this clinical maturity, but you're also finalizing your research. And granted, it can be a very hard struggle to do all of that and really gain that momentum still while you're going through it, but it is possible. And the last benefit is you can possibly matriculate into a PGY-2 spot. I've known a few general surgery residents that didn't have a urology focus that were able to strictly matriculate into a PGY-2 position, and that's fantastic for you. Now, the negative aspects of the preliminary year is we talked about the very demanding hours, trying to balance and juggle home life, research, step 3, possibly an in-service exam in between, as well as working an average of 80 hours a week over 4 weeks. When you're going through your general surgery preliminary year and you're doing interviews, you may have to use your vacation time for these interviews, depending upon if they're in person or virtual, and depending upon your institution's need. Not only you're having very demanding hours and you're having very demanding things compared to categorical residents, you're having to use that vacation time in order to go to interviews. And that leads to less vacation time, possibly more burnout. And so trying to stay well-grounded during this time period is very difficult to do. Some general surgery preliminary year or years do not allow urology or other subspecialty exposures. There are quite a few that don't, but there are quite a few that do. So if you're going through this process and have to go through the SOAP process, I would highly recommend you look into and email these programs to see if you can do a urology rotation or a subspecialty rotation and how many months you can do that for. Some preliminary years or programs do not allow you to do more than 1 month. Other programs may allow you to do up to 6 months of it. It just really depends upon the program. Another negative aspect is you're going to have to really advocate for yourself. There's not going to be a lot of people that are going to advocate on your behalf. And if they are willing to advocate on your behalf, you have to be willing to really go out there and say, hey, this is what happened. I didn't match. I found out why I didn't match. Can I work with you? Can I do research? And you keep on going and through this grueling process, and it's really a journey, but at the end of the day, you're going to be having to advocate for yourself and asking other faculty and residents to possibly advocate for you as well. So general surgery, urology focused preliminary year basically has the same pros and cons. However, I would argue that there's a little bit more benefit to doing a urology focus. Actually, I'd argue that there's quite a bit more benefit to doing a urology focus. One, you can have a higher possibility to matriculate into PGY-2 positions compared to general surgery preliminary years alone. For example, I believe there was 4 PGY-2 positions opened up in summer, and you can go through the AUA vacancy website to find that out on which PGY-2 positions are available for that coming year. And I know that all of these got filled through preliminary resident spots. Or actually, I know that 3 out of the 4 for sure got filled through preliminary resident spots. You also gain direct exposure to urology. For example, where I am at the University of Colorado, I've been able to gain extensive operative exposure. I've been able to do TURBTs, TURP, uteroscopies, laser lithotripsies, stent placement, removal, cystoscopies, and I've been asked to be the first assist or junior surgeon on RPL&Ds before. And so there's a lot of exposure that you can gain when you're directly doing urology for 6 months at a time. The other aspect is if you're in a urology focused one, you can do the in-service exam, or you can ask to do the in-service exam and see if your program is willing to allow you to do that, kind of see where you're at, what your percentile is at, how much you got correct in order to see how you're improving. Possibly getting a very high in-service exam percentage can lead to you even having a stronger application to matriculate into a PGY-2 spot. Now, the negative aspects we talked about before is going to be the same as the general surgery preliminary year or years as well. Now, a fourth option would be doing dedicated research year or years. Likely it will be years simply because if you go into a research year, you're only going to have 1 to maybe 3 months to finalize a research and get it accepted. Now, usually that's not enough time in order to really bolster up your application from the research perspective. The good aspect is you're going to be able to spend more time with faculty. You're going to be able to show them that you work hard. Stick to your word and say when you can finish something, you're going to finish it no matter what it takes. And you want to get a faculty member that's going to be able to advocate on your behalf for this situation. You're going to be able to present at local, regional, national conferences depending upon your research, and you want to do this in order to get your name out there, in order to tell them your story, why you didn't match, and what you're doing next in order to gain those connections. Because urology is a small field, like a lot of other surgical subspecialties, and a lot of people know each other nationwide or even worldwide. Now, the negative aspect of this application, we talked about not being able to complete a project before the next cycle, so that's why a lot of people do a couple years of research. Now, you're not going to be able to interview or obtain PGY-2 positions like we talked about on that AUA vacancy website, and that's a possibility. However, you're still getting your name out there. And so whatever is the hindrance to your application is what you really need to focus on. Now, granted, you can do preliminary year or years and still do research, and that may prove something more than just doing a research year or years. But you really need to focus on what would improve your application after talking with faculty members, program directors to see what is the next step for you. Now, the last option is really dual applying or pivoting. And so I kind of included these into one, even though they're two separate things, because it makes you think about different options that you may want to do in the future. And it's a very hard thing to do emotionally. So the good aspect is you can probably soap into a different position. Let's say you can soap into family medicine, internal medicine, maybe emergency medicine, and this gains you forward momentum. The hard part about that is you're completely pivoting your career. Another aspect that you can do is going through the next cycle, you can dual apply between urology and general surgery, and that will lead you to get more interviews and kind of keep that forward momentum. And you may be able to use those specialties in order to have extra practice to gain that forward momentum to become more confident during these interviews. The good thing is if you pivot, you can have a faster potential to attending salary. Also, if you dual apply, you may be able to dual apply into a PGY-2 spot into urology or general surgery or anesthesia or radiology. There's been quite a few people that I know that have done general surgery preliminary years or a year that have been able to go into anesthesia directly, that have been able to go into radiology directly. And so that gives you a faster potential to attending salary. But the big question you have to ask yourself is, can you see yourself doing something else? And if you can't, then I would argue that you should keep on going along this long road to medicine, along this journey, in order to get to where you want to be and what you want to do. The other aspect that you do have to consider is, how is this going to affect your family? Do you have a significant other? Do you have children? How long are you willing to pull your family along with you in order to obtain this dream that you have? Now, we talked about how it can be emotionally difficult to let go, and I would argue that this is probably the hardest thing, because when you don't match, there's so many emotions going through your head, and you constantly are thinking about, oh, well, can I pivot? Can I dual apply? What can I do in order to get a job? And it's going to be so difficult to just let this go and do it. And I think that kind of gives you an aspect of, this is why I should be pursuing the career that I should be pursuing. And so if you're dual applying or you're pivoting careers, now you're going to have to redefine your goals. If you're going into anesthesia, what do you want to do in anesthesia? Do you want to do general anesthesia? If you're going into radiology, do you want to do diagnostic radiology and see if you can also do interventional radiology to do procedures? If you're doing general surgery, do you want to do a fellowship? Now, if you're doing a general surgery program and you have to repeat your intern year and you have to do research as well, that's 8 years plus maybe a few years for fellowship. So you can be looking at a decade of training after medical school. And now you really have to redefine your goals on what you want to do. So overall, out of these options, what you really need to do is you need to find out why you didn't match. You need to talk to residents, you need to talk to faculty, you need to talk to program directors. So you need to see if the residents, faculties, program directors at not only your home institution, your sub-Is, but also the places that you interviewed at, if they're going to be fully transparent with you. Was it something that you did during your sub-I? Was it something that you didn't do during your sub-I? Was it your step 2 score that was in the 230s, 240s that led you to have less interviews? And this is the insight that you need to look into your application to figure out what was it that led you not to match. And you can look at it and be like, okay, well, is this my interview? Objective data is the thing that gets you the interview, but the subjective data is what really leads you into the ranking process. Can the residents see you working with them for the next 5, 6 years, depending on how long your residency program is? Do the faculty like you? Do the residents like you? Can the faculty also see themselves working with you for the next few years? All of this information goes into everybody's brain that's ranking you in their application, including the residents, including the faculty, including the program directors, without it being blatantly stated, as I've interviewed people during this last urology cycle. Or was it your letter of recommendation? Was there something said in your letter of recommendation after they looked back at it and they were ranking you that affected your rank? And so during my process, there was a sentence that said that for me, my home institution or my home state was home for me, and that led to program directors at outside facilities or outside institutions thinking that I only wanted to match at my home institution, and so it lowered me on their rank list, was one thing. My step 2 score was completely fine. I had 20 interviews, and so that wasn't the thing that hindered me. I feel like sub-Is are very difficult in order to find that fine-tuned balance between wanting to help do things, but then also not getting in the way of the residents. It's a very tricky and fine balance between the two. And the other thing that I was told from my perspective, talking with program doctors, talking with faculty, was that my interviews were great. The thing that they questioned was, could I balance surgical residency and have a family? And so in the back of the minds of some of these programs, can you balance being a father? Can you balance being a mother? Can you balance having children during residency? There's this fine balance of, do you want to include this in your application next year or do you not? And for me, I specifically included it because it was who I am. If the faculty or the program didn't want to match me simply because they didn't think that I could do this, well, one, I proved it during my general surgery urology focused preliminary year that I 100% can. Two is, do I really want to go there? And so these are a lot of different things, and a lot of these can be multifactorial in terms of why you didn't match. For example, another program that I did my sub-I at, match their home students or match people that were originally from that state, can come into their aspect of how they rank their list. And if their home students don't want to go there, then they rank somewhere else and they go somewhere else. And then that leads to however far down you are on the rank list, maybe 6, 7 down, in order to match into a 3 or 4 residents per year spot. And so that's kind of the backstory of how these things work from my perspective. But ultimately, you're going to have to figure out which of these 5 options is best for you and how are you going to solve this issue of you not matching, and what are you willing to do about it in order to match into your desired specialty. I'm Ray Smith. This is The Long Road to Medicine. If you're a medical student applying for residency, navigating the match, or raising a family, you're in the right place.